Okay, so here I'm going to talk about sepsis and septic shock. And so these are going to be potential outcomes for infections that are going to be spread systemically through the blood. So the first thing to recognize is that sepsis and septic shock can be caused by different types of pathogens. They are both going to be resulted from a progressive bacteria infection, as well as different fungus, protozoa, and viruses can also be the cause. So for bacteria, it could be either gram-positive or gram-negatives. Gram-negative are going to have their endotoxin, which are going to be LPS, and our gram-positive will have exotoxins, or superantigens. So in the case of the endotoxin, this is going to be all gram-negatives. In the case of the superantigens, this is going to be specific for our staph and streps. But it's important to note also that our fungus, protozoa, and viruses can also be the cause of shock. Now, sepsis is basically a very extreme or overreactive immune response to an infection. And sepsis can become life-threatening, so it needs to be treated. The symptoms need to be treated. Septic shock is going to be a significant drop in blood pressure, which leads to respiratory and heart failure. And other organs can begin to fail, and it will most commonly lead to death. Now, septic shock is the most common cause of death in intensive care units in the United States. So symptoms of sepsis are going to be fever. It's usually going to be a high fever, or it can be on the other end. It can be a very low temperature, hypothermia. You can have a fast heart rate, rapid breathing, so 20 breaths per minute, for example. And then sepsis can move into severe sepsis, which means you have a reduced amount of urine excretion of toxins, potentially. Acute confusion, dizziness, severe problems breathing. You can start to get cyanosis, the discoloration of your fingers or lips. And septic shock has the above symptoms with the added low blood pressure and organ failures. Now, what can cause this? This can be caused by, again, infections, bacteria, viral, or fungal infections. You can have digestive infections. So remember, if a lot of our digestive infections are caused by our gram-negative bacteria. And these guys have LPS. And so they all have the potential to cause shock. Also can be caused by pneumonia. Again, we have our gram-positive bacteria, or normal flora, which cause typical pneumonia. So this is going to be our strep and our staph. And both have the potential to cause shock. Urinary tract infections, especially if it's going to be caused by our normal flora, E. coli. E. coli has LPS, it's a gram-negative, it can cause shock. And reproductive system infections can also lead to shock. Now, risk factors are going to be in our newborns and elderly. Newborns, of course, for their size, they will succumb pretty quickly. Our pregnant women are going to be at risk, and especially during during birth, when there is oftentimes rupture of the tissues and you get blood exposure, and then the normal flora can infect that way. And this is an example of that. This is in July 2018, a 32-year-old mother gave birth to a baby, and with days, this mother unfortunately passed away due to shock. And she was probably exposed to normal flora bacteria during birth and a rupture of or tearing of her tissues, and it gained access to the blood and caused shock in this poor new mother. Also, immune compromised, of course, will be highly susceptible to shock. Now, sepsis and shock are diagnosed by detecting first pathogen in the blood. You get dissemination of pathogens. You have low platelet counts, so there is a problem with clotting. abnormal liver and kidney function, so that leads to an excess of waste products in the blood, decrease in the amount of oxygen, and an electrolyte imbalance. There are tests to test for this. You can have a urine test, you can have a wound test if the wound is open, mucus, spinal fluid, and blood tests are all available. Treatment, even if you give treatment, there still is a 50% death rate. IV antibiotics to control the actual bacteria. You're also going to, of course, give supportive care, corticosteroids, IV fluid. Corticosteroids are to suppress the immune response because your immune response is responding systemically, so it's sort of an exasperated response. You're going to give vasopressor medications to constrict the blood vessels in order to increase the blood pressure, and you're going to try to stable the blood sugar levels. Now, sepsis shock is different from toxic shock syndrome. Toxic shock syndrome is going to be caused by bacteria toxins. And toxic shock syndrome is going to be primarily caused by strep pyogenes or Staph aureus. Now, the symptoms are going to be a fever, a rash. Typically, especially with your strep, it's going to be linked to a skin infection. So you get skin peeling, and then similar to our septic shock, you're going to have low blood pressure. Now, both strep pyogenes and Staph aureus have a super antigen. And our super antigen will activate the immune response systemically. And so it gets overactivated, and then this will lead to shock. And we've heard this with respect to our COVID-19 infection because this is referred to as a cytokine storm. And so COVID-19 is not causing shock. It's actually the bacteria moving in, our streps and our staphs, that can cause shock and this cytokine storm. So the treatment, again, is going to be trying to get the bacteria under control so it stops producing its toxin. You are going to get drainage of any abscesses that form. Remember, Staph aureus is going to have coagulase. So Staph aureus can wall itself off, so it has coagulase. And so Staph aureus is going to produce a boil. And so a boil on the skin can be drained. And so it's similar to that. You'd have to drain, incise and drain any abscesses because basically Staph aureus is generating, in theory, a boil inside. It's just called an abscess. And again, you're going to try to get rid of these super antigens that these guys made to trigger that cytokine storm.